being intentional is important. Many of us donate goods, food, clothing, money, and that's an intentional act. But the research doesn't seem to have the physiological response as much as we can actually watch how our kindness has influenced somebody else's existence and how much it's appreciated. So randomness actually has better effects if we can just do them and not ignore the chance that we can be kind to someone.
A growing body of research indicates that intentional kindness is a critical component of physical and mental health, as well as economic well-being. Kansas State University Community Health Specialist Elaine Johannes explains how we can become more intentionally kind. On today's Sound Living, being kind is more than just being nice. Sound Living is a weekly public affairs program produced by Research and Extension at Kansas State University. I'm Jeff Wichman. Elaine Johannes, the Kansas Health Foundation's Distinguished Professor of Community Health at K-State, says that a new fact sheet, Kindness Matters, which was written primarily by Extension Family and Consumer Sciences agent Lisa Newman, includes resources and ideas for building kindness into daily habits. Elaine, we always think that people are going to be kind or at least nice. There is a difference, though, between being kind and being nice.
Yes. When I came into the building today, I had somebody be very nice to me. They opened the door. But I don't think they looked at me, and I don't remember their face. So that's a nice gesture, very expedient. It keeps the social lubricants going. Being kind is more intentional. It has to do with our relationship with people, with the world. It takes a little bit more interaction to be kind and to show that with our acts.
There's a fact sheet out from Extension, and one of the things that really surprised me, because I never really thought about it before, but there's actually some health benefits to being kind.
Yeah. I don't know if you've ever had the experience of being just uncomfortable. You feel maybe you're in a place or a business or even your own workplace where it's either fight or flight. You know, it's argumentative, and you can just tell that the people in that place are not happy, and it's not a kind place. And we get locked up, you know, and physiologically that affects our brains. It affects the hormones going through the creosote, which is a hormone that gets built up when we're under stress. And then our capillaries and our veins begin to constrict. And heavens, if we get like our heart starts pumping, you know, it's that fight, flight. And some people freeze because they don't know how to get out of that business that people don't like being there, you know. So there's some physiological reasons why kindness is important from a health benefit. That oxytocin, which is some people call the love hormone, opens up our ability to breathe, and it opens up our capillaries. It gets our systems working better. And if we aren't confronted by a harsh environment, if we're confronted by kindness and people who honestly want to relate to the people in that place, then that's really better for our physical health.
In terms of the mental side of it, there's also the benefits of just not only enhancing your mood, but it also kind of boosts your self-esteem.
Yeah. If I interact, as any of us interact with someone who seems to have compassion, or at least they are behaving like compassion people who understand that this is a social relationship, that people get along, the civility that we have in the workplace, it allows us to be more authentic. And if we can be more authentic, then we don't have to take our energies to be protectionistic. We don't have to watch our backs, let's say. So from a mental health perspective, we start to feel like I'm acknowledged. I'm a valuable person in this workplace or in this school, in this classroom. I'm also appreciated that I have capacity to interact with people, that I have capacity to actually improve the place that I'm in.
There's the benefit, too, of not being isolated, because this kindness means you've got to be interacting with others.
Yes. There's ample research. Clear back in the 1980s, 90s, there had been some early research done about the randomness of kindness. And there was actually an institute, and it still exists, the Foundation for Random Acts of Kindness. And the research around, is kindness a behavior that can be intentional, planful, or is it random? And what are the physiological reactions to either way that kindness is acted on, plus also emotional and social impacts? And some of that early research, and it's going on now, random acts do actually have a benefit to the person doing the act, but we're doing the act with somebody who's receiving the kindness, who is reducing their stress, who is being more calm. And, Jeff, when we get that reaction from a fellow human or a fellow, maybe a pet, that reinforces it. That allows us to know that I can feel the effects of someone that is more comfortable with who they are and comfortable with me. And it improves the whole environment. Now let's go back to intentional acts. Being intentional is important. Many of us donate goods, food, clothing, money, and that's an intentional act. But the research doesn't seem to have the physiological response as much as we can actually watch how our kindness has influenced somebody else's existence and how much it's appreciated. So randomness actually has better effects if we can just do them and not ignore the chance that we can be kind to someone.
And there is actually a way to build a routine for this?
Mm-hmm. In the fact sheet, and you mentioned the fact sheet that's coming out fairly soon from K-State Extension, you can actually put that on a calendar. If you want to be that planful about our intentions to be kind, you could actually, if you wanted to put it on an app on your phone, and you can be kind to yourself, maybe even make a list of, okay, today this is how I'm going to be kind when I get to the workplace. I'm going to check in with people. I'm going to see how their weekend was. I will offer to go get the coffee, or let me take your trash out for you, at the work site. So it can be that planful, but it has to be interactive. So yes, some people may actually be that specific about the kind of kind behavior that they would want to exhibit in the workplace. Now, the workplace has to support that, of course. If we decide to be kind either in the school, the classroom, our faith community, our family, the workplace, and it's not reinforced, we don't get the opportunity to see it affecting others, nor do we have people learning from what we do. So it's like you're almost trying to coach and model to improve the whole place, the whole work site, the whole classroom. And it can be done as long as the person that's behaving in that kind, meaningful way is persistent.
So this is something that can spread throughout the workplace.
Oh, yes. In the fact sheet is a very short snippet about a really wonderful article about in cardiovascular cardiac care. There's a study about physicians that were cardiac specialists. Those that thrived had workplaces that were conducive to kindness in their own cardiac care team, physicians to physicians. If there wasn't kindness in that team, then the chances of those physicians staying together went down. On the same kind of tone, there's another article right adjacent to it of a study about cancer care. And for that oncologist, the cancer specialist that actually did kindness as he or she were doing the actual chemotherapy or doing the actual cancer care, the patients improved. They had quicker remission. They stayed more healthy during their chemotherapy because the patient then was understanding, watching, and learning how that oncologist behaved in a kind way. And that was over time. That wasn't just, for a couple of weeks. Over time, the outcomes for people who were getting cancer care as patients improved because their cancer doctor was kinder. And so that cancer doctor, they also worked in a more kind unit and a department. And so it was a win-win on all sides.
And some of this is just making sure that we're listening intently or even making sure that we're volunteering our time.
Yes, volunteering time. Wouldn't it be great if in the workplace or the school place, everybody got a chance to volunteer and be kind as they were volunteering, not to be disgruntled by it. It wasn't a mandate. It was a choice that everybody got to see how their acts affected the rest. Listening, again, would be really wonderful if it's intentional. Oh, I can behave in a kind way this time. My friend is having a tough day. I can cue myself off of them. But, Jeff, it can be random, too. It can be a stranger that we had no idea, and we're sitting next to them in an airport, and maybe we missed a flight, and we can be kind in that way without even expecting it. And we can receive the kindness. And that's the other thing. I think in our hurriedly days, we're all kind of on edge to anticipate what's the next shoe that's going to drop. What's the next harm that I'm going to notice or I'm going to experience? If we see kindness given to us, wow, somebody was kind to me, and I acknowledge that, and I'm able to breathe more easily. I'm able to acknowledge that. And I then, in turn, can maybe impart that to the next person. And these are all things that we learned, I guess, in preschool. Well, as adults, we need it now. We really do need it now. And we need it everywhere we are to show that we can not only benefit others from our kindness, which can be intentional, randomness works, but also we can receive it, and we can receive the health benefits, the mental health benefits, the social benefits. We aren't all on edge, and the economic benefits. The economic benefits of working in a place, investing our money in a place, acknowledging the business place that is built on a kindness for each other. It's a win-win.
And as you mentioned, that being spontaneous with our kindness can kind of, if you're in a situation where someone is stressed out or a whole group is stressed out, sometimes that one act of kindness kind of brings everybody back to, I guess, maybe an even keel.
Yes. So the Random Foundation, the Random Act of Kindness Foundation, if you get on their website, there's a whole list of just very simple acts that doesn't cost any money, that doesn't really cost a lot of time, where we can impart to our friends, to others, and then share that and actually make it a habit. That's the other thing that can happen. You know, I mentioned there's a calendaring. You can get an app and download it on your phone. But being kind can actually become just a habit that we lean towards. But it's a choice at first. It's a decision, because I think many of us are so accustomed to watching out. Is this a safe place? Is this a place where I can be trusted and will be trusted myself as I move into the place where I work with folks? So it can become a habit if we practice it over time.
And this will be, as you mentioned, the publication will be coming out shortly. And this is something that agents will have information on and probably do some of their one-on-ones with?
Yes. So the extension agents out across the state will be getting the Kindness Matters fact sheet and leader's guide very soon. Training is coming up here. What we're really hoping, Lisa Newman, who is the local agent in the Central Kansas District, which covers Ottawa County and Saline, she is the primary author. I just kind of helped. But what we're really hoping, Lisa and I hope, that this lesson, this information will propel discussion. And it'll propel it, hopefully, in families, around the Thanksgiving dinner, which is coming up, as well as in our workplaces and in our schools and communities. So we're hoping that discussions will come out, and then maybe even a campaign. Back in the 90s, early on, there were campaigns in schools where children were encouraged to do random acts of kindness, and I think that might be something we want to return to.
Very similar to the 48 hours of 4-H.
Absolutely. Make it a campaign, make it fun, make it engaging, and do it long enough so people become comfortable with the habit of being kind.
That's Kansas State University Community Health Specialist Elaine Johannes. The fact sheet, Kindness Matters, is available through the KSRE bookstore or can be downloaded online for free. Sound Living is a weekly public affairs program produced by Research and Extension at Kansas State University. I'm Jeff Wichman, and this is the K-State Radio Network.